you are a functional medicine doctor, but you're an internist, like classically trained, and now
Mhm.
you also practice in a functional medicine style, which people might. I mean, I think my audience is pretty familiar with functional medicine, but let's just go into your background, why you decided to practice medicine in this style as a licensed medical doctor.
So I was, like you said, traditionally trained as an internist, and I could see that medicine was changing just about 10 years or so ago, that medicine started being dictated by insurance companies and then big corporations and big
Mm.
pharma. And I just was seeing that things were changing, and I was like, wow, this is not how I want to practice medicine. I didn't want to be rushed and do the 10-minute visit per patient and just give that pill for an ill. So I was like, okay, there's something different here. I need to spend more time with my patients. That's how you get to know what's going on with people, is by listening and asking the right questions and spending that time with them and building that relationship with people. And I was like, okay, I've got to do something different. And I heard about other practices doing something where they did a membership, which you weren't dictated by just the insurance company. You could spend more time with people and actually give that quality of care by not being rushed and not having to do that hamster on the wheel type practice. So I changed my practice to a membership practice. And around that same time, I went to a conference and heard these brilliant doctors talking about the traditional way of practicing medicine, of going back to the way both of my parents were physicians, and I grew up in a very small town. So I knew how medicine was practiced with that quality of
Mm.
knowing the patients, and then being there for them when they need it. And I'm like, this is what I want to do. But I also want to go back to the way our bodies are meant to heal. And that is really getting to the root cause of why people have a problem instead of that rushed in and out pill for an ill.
Mm. I mean, so much of modern conventional medicine is really about like treating symptoms as opposed to dealing with root cause. And that's what I loved about functional medicine too, when I discovered it with my own health journey. So I love that you're doing that now. So how is it different? You mentioned about time, that you spend more time with patients, which I'm sure patients love because we
Yeah.
all want to be heard. And how can you know, how can you get to root causes if in a 10-minute thing you can't, right? So
No.
how is it how does that like first meeting with a patient, how's that
So,
different?
yes. So, my first meeting is an hour and a half, it's 90 minutes. And I ask a lot of questions and I sit and listen to the patient. So, I want them to tell me first, what are you having problems with? What are your pain points? And what are you looking for? Because they're, number one, they go, I've been to the regular doctor. And for one, they don't listen long enough. They
Mm.
give me that pill for Neil, but they dismiss me. And I'm like, but I'm still having this problem. Like, let's say they may still be having some joint pain or some rashes or their guts messed up, and they've had the GI scope, and the doctor goes, "Oh, your gut looks fine. Here, take this pill." And sends them on their way. And they're like, but I still don't feel right. There's something still wrong. And so what functional medicine does is we go, okay, well, let's get to the root cause. And let me find out, what are your problems, and let me just, you tell me what's going on, and then I'll start asking questions that no one's ever asked them before. I mean,
Mm.
one of my funny things, there's several things I will ask, but the first thing I'll ask is, are you pooping every day? How's your bowel movements? And they're like, what? You're asking me how? Even the GI doctor doesn't even ask them how their bowel movements are. And so they're like, no one asked me that. And I'm like, well, the gut is the window to the
Yeah.
rest of the body. And I
Mm.
want to know how your gut is. So that's one of my big things. I'll ask them that. I'll ask them, how are you sleeping? What's your quality of sleep? Are you tired when you wake up? How's your day? Or do you get that slump after lunch? Or the other thing I'll ask them, okay, where have you lived? What kind of toxins have you been exposed to? And one of the things that I find is that people don't know. Well, first off, I'm gonna go back. We had a big hurricane. I live in North Florida, the north in what we call the Panhandle, the Emerald Coast of Florida. And so we get hurricanes.
Hmm.
And 8 years ago, we had a big hurricane that wiped out our community, and everybody had to get new roofs. Well, there's been a lot of water damage. People don't know they're living in water damaged buildings, which grows these toxic molds. And
Hmm.
these and it's hidden. So a lot of people don't realize that they're breathing in these toxins from these water damaged building molds called mycotoxins. So I'll ask questions about, like, tell me when your symptoms started. Where were you living? Was there anything that you could have been exposed to? So I go into these environmental questions as well. And that's kind of like my third pillar. I kind of say I have four pillars. The first is gut health. The second I'm going to talk about is hormones. I, really have a lot of training, advanced training in hormones, and we know that hormones are very important. The third thing, like I did talk about, is toxins, environmental toxins, and how to detox. And some people just aren't good detoxifiers like me. I know I'm not. And then the fourth thing, I'll talk about lifestyle. And people are like, wow, a doctor's actually wanting to know how much stress I'm having, how am I sleeping, what activities am I doing, what am I eating. So we
Hmm.
go into all this, and it's really been eye-opening for me as a doctor to see the transformations that people are having and doing, just sitting and talking and listening. And then the thing about just different than traditional medicine, yes, I can do their basic labs, but what I do now is I do more advanced labs to look for inflammation in their
Hmm.
blood that's causing in their body their pain. And and then the inflammation markers that I'm doing are advanced for cardiovascular as well. Because a lot of people don't realize, but if you have, it's not about cholesterol, like just total cholesterol. I have a lot of women that come in to see me that have high cholesterols and they can't tolerate a statin. And I'm like, yeah, well, it's not about treating the lab, it's treating the person. And I'm like, well, if your cholesterol is this high, let's do some advanced testing to see if this high cholesterol is actually causing problems in your body, because that's what we're looking at. Is it causing heart damage? Is it putting you at risk for stroke? Is it putting you at risk for dementia? Is it causing your pain, your inflammation in your body?
So are there times that people can have high cholesterol and then it's actually not causing a problem in their body?
Yes, all the time. I see this.
What?
Yes, yes, and vice versa. People can have
Okay.
normal cholesterol and have heart problems or stroke problems. I mean,
Mhm.
how many times have you heard people say, I went to the doctor, my cholesterol is normal, and then I have a heart attack or a stroke not long after? Or that person, a lot of men will go to the doctor and they go, oh, my cholesterol's fine. And they'll be out for a run. And then, you hear about the person having a heart attack 2 weeks later. And that's
Mhm.
even after having a normal stress test a lot of times. I mean, so you can't go by those kind of tests. So what I like to do is I do an advanced cardiovascular panel through the Cleveland Heart. It's called Cleveland Heart Labs. It's through the Cleveland Heart Center. And it gets a lot of these advanced markers that are so easy. Now we can order this and insurance covers it. That's the beauty of it.
Wow. Hmm.
And I know Dr. Mark Hyman's doing function health labs, and he's doing a lot of these, and people are paying out of pocket. And I'm like, I've been doing these labs for 10 years and insurance covers them. And this is what I've been doing. I can honestly say that my patients, when they come to me, I'm taking them off their statins. I'm taking them, they're getting their blood pressure down. They're not in the hospital.
Hmm.
Like with the way I've started changing my practice, people are healthier. They're losing weight. They have better energy. Their pain is better. Their just overall quality of life is better. And it's
Mm.
all through this functional medicine route that I found, started doing over 10 years ago. And it took me a while to wrap my head around it because I'm traditionally trained. But once I
Right.
started trying it on people and seeing the changes, it's been life changing, not only for them, but for me as well.
Oh, that's so beautiful. I mean, really, anyone that's become a doctor, you want to ultimately help people. And I've thought about this so many times that you the training seems to me it's like take the symptom, match it up with the drug so that it can be covered by insurance, and then put people on the drug. Um, and I mean that's what was offered to me, and I knew that wasn't right. I just knew it wasn't right, and it wasn't for me. But a lot of people will just accept that, like a statin, for example. So many people are on statins and they're just told, okay, no, it's like we'll put you on this, and it's lowering your risk of a heart attack. But like, so what's the problem with statins? What?
So,
Because a lot of people don't realize. So I'd love
right. And
to
that's,
hear
and I'm
that.
not saying statins are not for everybody, because I do use statins, and I can,
Hmm.
in certain people at certain times. But I like to use the lowest dose. I mean, it doesn't have to be a dose you take every day. Some people do fine with just taking it 3 days a week or every other day. But what I
Hmm.
do is I can do this, what we call risk stratification. Like, okay, let's see if you really do need it. So what I like to do first, like I said, I'll do this Cleveland Heart Lab, and it'll look at not just the total cholesterols, but I'll look at the dense particles, like the small dense particles, the size and the number of them. I'll look at especially the inflammatory markers. We have a whole panel of just looking at inflammation, because we know inflammation is what causes the problem, right?
Right.
So let's look and see if you have an elevated HSCRP, which, that's a whole nother thing. We can look at these inflammatory markers. I can look at things like their insulin resistance score. I can see if they are pre-diabetic. Do they have what they call this LP little a, which is kind of a genetic lipoprotein that puts people a little bit more at risk for strokes and dementia and things. And then I'll say, okay, let's I have a special ultrasound. These people come in about every 3 months to my office, and it's an ultrasound of the arteries of the neck. But what we're doing is not just looking at plaque, but we're looking at in millimeters in that lining and the wall of the arteries, and we can see exactly, do they have plaque, in how big the plaque is. Is it soft? Is it hard? In other words, is it stable or unstable? And we can risk stratify with that. The other thing I'm doing now that is starting to catch on in my area, which they weren't doing before, is doing the CT scan of the heart to see if you have plaque in the arteries. And then there's even this new advanced test that I love to use. Is called Clearly, Cleerly, and it is a dye with an angiogram with a CT, but they send this software for AI to see, looking at plaque in those arteries around the heart. So there's so many new things out there now that we can do, instead of the old fashioned way of just, oh, your LDL's high, here, take a statin. There's so much more to it than that. And that's what traditional doctors, a lot of times, it's not their fault, it's how they're
No.
trained. And I'm not
Exactly.
trying to bash other doctors. I'm just saying, there's when you spend time doing research and learning and really investigating, then we find out there's more we can do.